All right, guys, this is Martin from Reform. I wanted to shoot you a video today, which I believe is the most important video I have shot for you guys so far. And I think that says a lot because there's been a lot of great content out of this office for the past couple of years. But the most important thing is looking at the spine itself, how the spine moves, and then how the spine gets in trouble. Because ultimately that trouble for some people is pain. Some people it's dysfunction. Some people it really becomes a problem where they are losing function. And it all stems from a problem that starts in the spine. So that's what I wanted to touch on today. And everything about chiropractic is focused on how your spine moves, or more importantly, what happens when your spine stops moving properly. So I hope you get something out of this. Share it with anybody you think needs to hear this, because this has everything to do with chronic back problems, chronic neck problems, throwing your back out or getting a kink in your neck, because all those things have to do with your spine and spinal motion. Now, the kind of old school or the theory of chiropractic was, there's a bone out of place and you would come in and you'd get an adjustment. Bone would get back into place and away you went. But so much research has been done over the last 10 or 15 years that it's not even a bone out of place as much as what's known as VSC, which stands for a vertebral subluxation complex. So some of this will be pretty technical, but I think anybody who's looking for a permanent answer to back pain, neck pain, spinal issues, this is going to help you tremendously. So when you think about two bones moving, okay? So when we think about, this is a model of somebody's low back. So for me, I'd be sitting here like this. And, these vertebrae have a lot of very specific motion. So just looking at these top two, and this resonates all the way up and down the spine, that each two have very specialized motion. Now, different chiropractors use different terminology for a subluxation or this vertebral subluxation complex. Somebody may call it a fixation or a restriction or a stiffness even, and that's what they're going to come in and they're going to deliver their adjustment to. Because ultimately the adjustment is correcting the spinal problem in motion, okay? So I hope that helps you so far, that right away when you end up with bad motion in a spinal segment, of course you're going to eventually end up with throwing out your back, some pinched nerve that keeps coming back, because ultimately the problem is how these guys are working together. And over time, when you have a bad area of your spine moving badly, you know what's going to happen? I mean, it's fairly straightforward, but it's going to be damage and degeneration. And for the person who keeps throwing their back out in their 30s or 40s or even 50s, well, leave that alone for enough time, and that bad area will end up arthritic for the most part in just about everybody, because it's high pressure, high stress over time, right? PSI is pressure per square inch, and enough pressure means that the area is going to break down, okay? So that's the first thing I want to share with you, just how subluxation or vertebral subluxation complex causes a lot of problems right here in your back, in your spine or your neck. The second thing that does happen, which is incredibly important, is your whole spine is literally wrapped in nerve tissue, right? So nerves surround this, nerves surround the joints, and nerves surround these discs. So now when you get a subluxation, so I'm going to just exaggerate this to make a point, you get bad alignment here. Now guess what all those nerves are doing? You have a system of nerves called efferent nerves, which are going this way, and then you have a system of nerves afferent going back down. So you always have this constant loop of communication to your brain, and then your brain makes decisions based on that information, and then it controls your body. Okay, so I hope that makes sense so far. You have every part of you going up and then back down. So guess what happens when you have chronic back problems, chronic subluxation and bad motion way down here? Guess what's getting up to your brain? Well, it's going to be bad information, right? And from a computer, your CPU, your brain is just getting bad data. And then based on that bad data, guess what your brain is doing? It's telling your body what to do, but it's already based on flawed information. So do you see that? So do you know why people keep throwing their back out? Bad data, bad programming, bad data, right? Does that make sense? That's why a lot of these problems don't go away unless you actually fix the root cause. You fix that underlying problem that's going on in your spine. Okay, because now I'm gonna pull a full spine up here, so I hope you guys can see this. So now this is more like me in my full, heads up here, pelvis is here, right? Some of the most common areas people develop subluxation are wherever the spine is changing its curves, right? So right here, bottom of the skull, right here, you know, kind of upper back between your shoulder blades, upper low back, and then of course the low back pelvis. Really high areas of stress in a normal day-to-day life, really high areas that we can assess and measure spinal stress, subluxation in this office, okay? You know, I had a conversation just last week with a new patient because lots of people are looking for care post-COVID. You may understand that it's a very stressful time for a lot of people, but it had to do with upper cervical, so top of the neck, subluxation patterns, which we could measure here. And because of that, they were getting chronic neck pain, chronic shoulder pain, and headaches. So all these things that, you know, in his eyes, they weren't really related, but when we could trace them back to spinal issues, putting pressure on joints, nerves, causing muscle tension, causing all of these things, all of a sudden the light bulb went on that, you know what, they're all linked to spinal motion and spinal subluxation. Now again, here, like this gentleman, it's all upper. You know, this from postural stress, you can see chronic areas of subluxation. If you can envision someone who's really hunched over, you know, like computer, or my visual is always, you know, you're walking through a mall or down the street and you kind of see a little old lady who's really hunched over. Well, there's chronic patterns of subluxation developing in their spine, which eventually we know will damage their spine itself. And then of course, like, I want to say the holy grail, but the chiropractic, you know, is famous for fixing low backs. But of course, there's a complicated mechanical system of hip joints, sacrum, lumbar joints. Everything here has to move properly if you want to live without back pain, right? Every single joint has to do its role in keeping you functional. So I hope that gives you a little bit of information, excuse me, about what we'd look for in this office in terms of the root cause of chronic neck pain, chronic back pain, because of course, if your spine has subluxation or more technically vertebral subluxation complex, bad motion right at that spinal level, of course you're going to battle the same problem over and over and over again until you get the spine moving right, corrected. Build a strong muscular core to support that spine, and then you live as best as you can your best life. All right, so I hope that helped. Again, this is Martin at Reform. If you know anybody who's struggling with chronic back, neck, just spinal problems, tag them on this. This may just be the information they're looking for. And if you have any questions, just shoot me a message. Comment below. I'll be more than happy to help any way I can. Thank you.